Hello, I'm Dr. Jacob A. Shipon, and I'd like to talk to you today about preventive medicine. I'm going to use this term a lot, and I think I do. We must understand, where have I heard that before, that there are significant toxins of every kind in the sky, unfortunately, the water, the ground, primarily in the foods we eat also, unfortunately, with the preservatives and the antibiotics and etc., etc., etc. And these chemicals, these are toxins to our body. And it should be understood also that other toxins, such as oxidative stress that comes from the wrong mindset, anxiety in itself can create oxidants that destroy DNA. And you know our goal is to protect the DNA. Mindset, of course. Diet, the wrong foods will do the same thing. The excessive sugars, the excessive fats, the wrong kind of complex carbohydrates, processed complex carbohydrates, the wrong kind. No, cookies, cakes, candies, pies, pastas, the wrong kind. Remember, these create oxidants. And lack of exercise, developing large amounts of white fat, which is particularly around the abdomen, very damaging, because the fats, they do so many negative things. And one of the negative things happens to be inflammation. It creates inflammation. And I'm not going to go into all of the negative components that it does. But believe me, it does all of that. And we must do everything we can to diminish that. For the last, 45 years, actually longer than that, my entire medical career has been spent primarily in preventive medicine. And I want to tell you what I did, and I want you to understand that the results have been phenomenal. Essentially, I established a company that would do a history, physical, diagnostics for the purpose of risk stratifying the patient. Utilizing the Framingham study, which is a study that has almost become the standard, but we added other risk factors. And I won't go into that now, but at our website, uspmed.com, it will be defined. Once the individual was risk stratified and we determined what had to be done, we placed them into a program called MediFitness. MediFitness was a company that basically had all of the police department and fire department go through it. And this company primarily focused on the issue of what is the individual's risk of cardiovascular disease, etc., etc., etc. And what we did was provided mindset programs, diet programs, exercise programs in order to diminish that risk. And we did risk stratifications again to see the improvement, and there was major improvement. In the studies that we made, and we had PhDs, cardiologists involved with it, PhDs in exercise physiology also. And what we found, that not only did we diminish their risk by putting them into a different risk stratification, improve the risk stratification, we dropped the blood pressure, we dropped the weight, we dropped their medications, we took individuals that were diabetics and made them normal. We did all of these things and improved their possible longevity. We have the studies to indicate that this is the way to go. So understand that what I'm saying to you is not made up. It's not, perhaps, it'll work. It will work. But remember all of the discussions that I made initially in this video about oxidative stress, about toxins damaging, all of these things damaging DNA. Well, we are involved with regenerative medical centers that will renew the cells. And when I say renew the cells, that all of the damaging that is done affects the telomeres and shortens the telomeres. And as we know from USPmed.com, that these telomeres, when they're too short, that's cell death. We want to avoid that. And the programs that we offer increase the length of the telomeres by increasing the telomerase enzyme that does that. That's our charge. We do that, and by that we increase longevity. So please go to my books, go to our website, uspmed.com, and follow that. It has all the information you need to know about longevity. There is another book coming out, which will be a second edition on a life of optimal well-being, and a third book on longevity. So these will be out in the next few months. So review them and tie them into the website. There are programs that are going to be on the website that are going to be very interesting for you, and it's going to help you in relative to longevity. Listen, just as I've said to my patients for 40 years, you are empowered. You are empowered to take this responsibility about how to maximize your longevity. No one can do it for you. There are no programs that are going to put the information in your mind. You're empowered to get it. We'll provide that information to you, and we'll provide that avenue. So thank you for listening to me. I hope you're not tired of me by now, but take care.